Hepatitis. Clinical manifestations: abdominal pain, inflammation of liver capsule, fatigue, malaise, fever. Systemic inflammatory signs: nausea, vomiting, anorexia, decreased appetite, pruritus, itching, bile salts under skin. Jaundice, yellow skin sclera from bot bilirubin. Dark amber urine, bilirubin excreted in urine. Clay-colored stools, bile not reaching intestines. Irritability, headache, flu-like symptoms. Hepatomegaly, enlarged tender liver, possible ascites or edema if chronic or severe. Stages: prodromal, preicteric, fatigue, malaise, NV-RU pain. 2. Icteric, jaundice, dark urine, clay stools, pruritus. 3. Convalescent, symptoms resolve, appetite returns. Diagnostic findings: AST and LT, hepatocellular inflammation, ALT liver-specific, alkaline phosphatase, ALP, cholestasis or biliary involvement, bilirubin, total and direct, impaired excretion metabolism, albumin, decreased protein synthesis, PT-INR, impaired clotting factor production, ammonia, hepatic encephalopathy risk. Viral markers: HAV, HBV, HCV, HDV, HEV, identify type. Ultrasound CT, assess liver size and flow. Liver biopsy, confirm inflammation or fibrosis. Cirrhosis. Clinical manifestations: fatigue, weakness, malaise, jaundice, bilirubin, ascites and abdominal distension, fluid retention, portal HTN, peripheral edema, albumin, anorexia, nausea, vomiting, weight loss, poor digestion, abdominal pain or bloating, spider angiomas and palmar erythema, estrogen, bruising, petechia, bleeding gums. Clotting factors: hepatomegaly, splenomegaly, confusion, asterixis, flapping tremor, ammonia, hepatic encephalopathy, gynecomastia, amenorrhea, hormone imbalance, dark urine, clay-colored stools, hemorrhoids, esophageal varices, portal hypertension. Diagnostic findings: AST, ALT, hepatocellular injury, ALP, bilirubin, biliary obstruction, albumin, poor protein synthesis, PT-INR, impaired coagulation, platelets, splenic sequestration, ammonia, encephalopathy, hyponatremia, fluid retention, ultrasound, CT, MRI, nodules, ascites, fibrosis, endoscopy, EGD, varices detection, liver biopsy, confirm cirrhosis and fibrosis severity. Clinical manifestations: often asymptomatic early, RUQ pain or discomfort, tumor pressure or liver enlargement, weight loss, anorexia, fatigue. Jaundice, bile duct obstruction, ascites, abdominal swelling, impaired venous flow, nausea, vomiting, early satiety, dark urine, clay-colored stools, pruritus, bile salt buildup, fever, sometimes necrosis or infection, leg edema, late, palpable firm irregular liver mass, referred pain to right shoulder back, diaphragmatic irritation. Diagnostic findings: AST, ALT, ALP, bilirubin, impaired function or obstruction, albumin, PT-INR, poor liver synthesis, alpha-fetoprotein, AFP, tumor marker for hepatocellular carcinoma, ultrasound, CT, MRI, tumor visualization, staging, liver biopsy, confirm cancer type stage, angiography, PET, assess metastasis or vascular invasion, AFP plus imaging, diagnostic standard. Liver trauma. Clinical manifestations: RUQ pain and tenderness, hallmark sign, abdominal distension and rigidity, intra-abdominal bleeding, rebound tenderness, guarding, peritoneal irritation. Signs of shock: hypotension, tachycardia, tachypnea, pale, cool, clammy skin, restlessness or confusion, nausea, vomiting, diminished bowel sounds, ileus from irritation, right shoulder pain, Keir sign, diaphragmatic irritation, decreased urine output, hypovolemias, renal hyperfusion. Diagnostic findings: CBC, hemoglobin and hematocrit, active bleeding, AST, ALT, hepatocellular injury, bilirubin, bile leak or obstruction, PT-INR, coagulopathy, CT scan, gold standard, visualize laceration bleeding, ultrasound, fast exam, detect free intraperitoneal fluid, type and cross-match, prepare for transfusion. Serial H&H monitoring, assess ongoing hemorrhage.